to our breast reconstruction education with UNC Plastics. We will do a broad overview of the reconstruction options that we offer here at UNC. These are our plastic surgeons that you will meet during your breast reconstruction journey. You are paired with a plastic surgeon based on your surgical oncologist and OR time so that we can ensure safe and quick OR access. At UNC, we do have a few advanced practice providers that you may potentially see during your breast reconstruction and post-op phase. Typically during this process, though, you will get very close with your plastic surgeon's nurse. Each plastic surgeon has a dedicated nurse to their practice who can help you with education, FMLA paperwork, questions, pre-op and post-op. While we go through this education, we recommend writing down any questions so that your surgeon can answer them at your upcoming visit. A very common question we get is, will insurance cover my surgery? There is a federal law created so that breast cancer care is covered by insurance, and a North Carolina law that covers the non-cancer breast for symmetry surgeries. That being said, all surgeries are submitted to your insurance to ensure coverage. Now we'll get into the reconstruction options. We have immediate reconstruction, which means the plastic surgeon comes to the OR on the day of your mastectomy. We have delayed reconstruction, where your plastic surgeon comes on a different day than your mastectomy. We have direct to implant, tissue expanders, latissimus dorsi flap, deep flap, oncoplastic reduction, and aesthetic flat closures. While we do lay out a lot of options and a lot of information, the biggest thing is what reconstruction is right for you. And at your upcoming visit, your plastic surgeon will review your current and past medical history, your goals, and your options to try to find the best path forward. The first thing I'll talk about are tissue expanders. These are a temporary device that we use to make space for a breast implant or to allow for cancer care to continue before we do a flap procedure. These are either done on the same day as your mastectomy or can be done at a later time if you've chosen delayed reconstruction. The benefit of a tissue expander is it ensures that the mastectomy flap is healthy and the incisions heal well and there's a good blood supply, but it also gives you the ability to have input on your final size. Now, they do require several office visits to slowly fill the device with saline and to slowly expand that breast tissue, creating healthy tissue to support an implant or to support a flap. They will stay in place for several months prior to your next reconstructive surgery, and this surgery does require an overnight stay. Direct to implant surgery is only available at the time of your mastectomy, and it is an immediate reconstruction. The desired outcome of your breast has to be similar or smaller in volume to your current breast size, and this is to ensure that the mastectomy flap can safely support a breast implant. So we will need the backup plan of tissue expanders because the tissue will have to be checked at that time to ensure that it is a safe option. We also use alloderm at this time, which is an acellular dermal matrix, and it is used to create a sling for the implant to keep it in place and keep it safe. This surgery also requires an overnight stay. So we do have two implant choices, saline and silicone. Saline is a silicone shell filled with saline. Rippling with this kind of implant is pretty common. When it comes to rupture, it is very obvious because there will be a decrease in size. When these implants are ruptured, they need to be replaced in about 2 weeks. For silicone implants, now they're a silicone shell filled with a silicone cohesive matrix. They're very technologically advanced, and so that if they were to be sliced or rupture, the silicone stays in place. It's almost like a gummy bear, and they do provide a more natural feeling. Implants do require monitoring. They say 5 years after placement, and then 2 to 3 years after that, with a life expectancy of 10 years. It's actually very common now for insurance not to cover this imaging and not to cover exchanges, because unless there's a problem with the implant. If you happen to have new sudden onset of pain or a change in the implant, then we would get imaging and see if there's an issue with the implant. What to expect post-implant based surgery is an overnight hospital stay, drains, usually 2 per surgical site, restrictions for about 4 to 6 weeks, that's also dependent on healing, daily dressing changes, and a round-the-clock compression bra for about 6 to 8 weeks. The next surgical options that we will discuss are autologous breast reconstruction options. This is when you use your own skin, fat, muscle, or blood cells to create a breast. There's the lat flap, the tram flap, and the deep flap. The first one we will discuss is the latissimus dorsi flap, the lat flap. It's when you take skin, fat, muscle, and blood vessels from the back to the chest and create a breast shape. This is a pedicle flap, so the blood vessels are still intact. This is a smaller flap, so you typically require a tissue expander or an implant if you're trying to be a certain size. This type of flap can be really helpful if you're starting reconstruction after radiation or you've done delayed reconstruction. Surgery can take about 3 to 5 hours, and the hospital stay is 2 to 3 days. You will have an incision on the chest and the back, as well as drains at the chest site and the back site. Depending on your surgeon, you might have no bra or compression for 3 months post-surgery, but sometimes we will have you in a loose bra post-surgery for about 3 months. You will be required to keep arm pressure off the trunk for about 4 weeks post-surgery. The next flap we will discuss is the tram flap, the transverse rectus abdominis myocutaneous flap. This is also a pedicle flap left attached to the blood supply. This is really only an option for unilateral breast reconstruction, and because there's usually enough tissue, there's not an implant required. You cannot have had any other abdominal surgeries to be a candidate for this surgery, and this surgery actually has to take place in stages. An initial surgery to divide blood cells, and then several weeks would be your reconstruction. The surgery takes about 5 hours, and the hospital stay is about 5 days. Restrictions are about 8 weeks, depending on healing, and you will also have drains in the chest area as well as the abdomen. The final flap that we will discuss is the deep inferior epigastric perforator flap, aka the DEEP. This flap is a free flap, so the tissue will actually be taken from your abdomen, including the blood vessels and the fat, and placed on your chest, connected to the blood vessels, to form a new breast. This can be one or both breasts, but the surgery can only be done once. Surgery can last 8 to 12 hours, and the hospital stay is 3 to 7 days. Because of the core work that is done during this procedure, restrictions last for 3 months, as it does take a while for the core to heal. You will have drains on each chest site and either side of your hips. What to expect post-autologous based surgery? These surgeries are bigger operations that require a little more post-op care. The hospital stay is multiple days, with usually at least one of them in the ICU, so that the flap can be monitored very closely. You will have incisions at multiple places and drains at those sites, the breast and the donor locations. Restrictions is anywhere from 6 to 12 weeks, depending on healing, as well as daily dressing changes. Once your reconstruction is completed and you've done your revisions and you are happy with your breasts, we then have options for nipple areola reconstruction. The first one is prosthesis. There are a couple of different locations that actually carry silicone prosthesis that allow you to have the areola and a little bit of nipple projection that you can take on and off. They're silicone or tattoos, it really depends. The next option is more permanent, and that is a 3D tattoo. That can be done at a clinic or at a cosmetic tattoo place or even a tattoo parlor, where they create the illusion of a nipple and an areola using 3D techniques. These tattoos often need to be touched up and can take several times to get the exact look that you're looking for. Then we have actual nipple reconstruction, which has some projection, which is a CV flap. They take the tissue in the center of the breast and do a surgical procedure to give it a little bit of projection. It takes about 2 weeks to heal, where you'll have to wear a surgical bra and dressings for about 2 weeks. With this surgery, it is important to note that you will have projection all the time, but sometimes it can flatten out. If that's the case, sometimes we have the option to do a skin graft from the groin to give that nipple a little more projection if that's what someone is looking for. After the nipple is what you are going for, has reached your goal, we would then do an areola tattoo around that flap to create the whole nipple areola complex. If you do decide to go with no reconstruction or delayed reconstruction, at the time of your mastectomy, they can do an aesthetic flat closure. Some of the surgical oncologists actually do this procedure, and sometimes plastic surgery does come, and they do the closure of the mastectomy flap and remove all the excess skin. It typically takes about an hour. You do stay overnight at the hospital, but that is due to the mastectomy. And it is important to note that you can always have reconstruction in the future. Another option is an oncoplastic breast reduction, and this is not done with a mastectomy. This is done in combination with a lumpectomy and radiation. We actually do a breast reduction technique that allows the removal of cancer and the reshaping of the breast to achieve a smaller sized breast. Because the radiation will change the breast skin and the breast size, we do hold off on any surgeries on the contralateral side for at least 6 months. This surgery takes about 2 to 3 hours. Recovery time is anywhere from 6 to 8 weeks, and then you will complete radiation, and you will have an overnight hospital stay. There are risks to each of these surgeries. Seromas and hematomas are collections of fluid or blood that can happen at the time of surgery or later throughout the healing process. Infection is a bigger risk, especially for tissue expanders and saline implants, as if they ended up with an infection, it is possible to need IV antibiotics or a removal of the implant. Because it is a foreign body, your immune system cannot fight infection on an implant. There is a risk of incision opening, which is why we discuss restrictions very strictly and talk about keeping those arms down and behaving much like a T-Rex. The loss of an implant, the loss of a flap, the loss of a nipple, and possible needs for additional surgery. Here is a detailed slide discussing those restrictions that we have pretty much after every single surgery. It's basically have T-Rex arms. If you don't think T-Rex could do it, then you shouldn't either. So no lifting anything heavier than 5 pounds. Stretching, bending, reaching, pulling, vigorous exercise, showering with drains, driving, or submerging in water are all going to be a big no-no. For submerging in water, it is actually a full 3 months from the time you have healed if you have an implant or a tissue expander before you can submerge in any water. When you have drains, we recommend waiting until the drains are out and then 48 hours after that before you shower. Now, here are some normal postoperative changes that we want you to be aware of. After each surgery, we do expect swelling and bruising. Some people will experience numbness or tingling. You can have crusting along the incision area, maybe small bits of blood and oozing at the incisions, and occasionally mild irritation along there. You will have surgical pain, which can be a more dull and throbbing pain. muscle pain, which feels like squeezing, spasms, and tightening, as well as nerve pain, which is the tingling, sharp shooting zings, as we'll call them, like pain. We do prescribe everyone a multimodal pain regimen to try to handle the pain from all the angles while not requiring heavy narcotics. Thank you for listening to our education. If you have any questions, please write them down and bring them with you to your visit. Your surgeon will go over all of these options in a detailed fashion so that we can find the right plan for you. Thank you so much for choosing UNC Plastics and Reconstruction.